So again, good morning, everyone. Welcome to the Orlando GI Journal Club. This is 7 a.m. Eastern Standard Time, and we are in Orlando, Florida. Our first study was published in Gastroenterology, and it's looking at the association of PPI use with dementia and cognitive decline in older patients. Prior studies have suggested that PPI use is associated with increased risk of dementia. However, prior studies were limited by incomplete assessment of medication used, failure to account for confounders, and claims-based diagnosis of dementia. The aim of the study was to investigate the association between PPI and H2 receptor antagonists with dementia. Can I please ask everyone to just double check that your microphone has been muted? Thank you so much. Okay. This was a prospective study. They looked at data from a randomized trial that was based in the United States and Australia of aspirin in reducing events in the elderly. This involved an analysis of 18,934 adults aged at least 65 years who had baseline and recent PPI and H2 receptor antagonist use. And this was determined according to review of medications during annual in-person visits. The incidence of dementia was defined according to Diagnostic and Statistical Manual for Mental Disorder Criteria. So these were the baseline characteristics. But what they did was they compared baseline characteristics between people using PPI and patients who were using PPI. And this comparative study composed of 14,000 patients using and not using PPI and 4,667 patients who were defined as PPI users. And then they looked at the association between baseline PPI and an H2 receptor antagonist use and dementia. And as you can see, in the non-user group, they had, we looked at the age-adjusted hazard ratio for developing dementia, and using non-user as the reference level of 1. And the hazard ratio for developing dementia in PPI users was 0.81 with a confidence interval of 0.67 to 1. When they looked at patients with dementia and probable Alzheimer's disease, again, the hazard ratio in the PPI user group was 0.77, but this was not significant as the 95% confidence interval spans 1. It ranged from 0.56 to 1.07. Now, when they looked at the incidence of dementia in patients who were using H2 receptor antagonists, again, the results were similar. There was no significant association between use of H2 receptor antagonists and dementia, with age-adjusted hazard ratio of 1.05, with 95% confidence interval of 0.6 to 1.73. And when looking at probable Alzheimer's disease, again, the hazard ratio ranged from 0.29 to 2.08, with an age-adjusted hazard ratio of 0.77. Then they looked at the association between PPI use and H2 receptor antagonist use and a cognitive impairment that was not enough to be defined as dementia. And as you can see, again, there was no significant association between baseline PPI use and H2 receptor antagonist use, with age-adjusted hazard ratio for PPI use of 1.02 with 95% confidence interval ranging from 0.93 to 1.11, When looking at multivariable hazard ratio, again, it ranged from it was 1 with a confidence interval ranging from 0.92 to 1.09. When looking at H2 receptor antagonist use, again, there was no significant association with age-adjusted hazard ratio of 1.06, 95% confidence interval ranging from 0.8 to 1.36. And we're looking at multivariable hazard ratio. Again, this was not significant with a hazard ratio of 1.02, with 95% confidence interval ranging from 0.79 to 1.31. They then looked at the association between baseline PPI use and baseline cognitive score and change over the study period. And when they looked at the association between change in cognitive score by looking at this composite Z-score, they found that, again, this was not significant with p-value of 0.85 when looking at PPI users versus non-users. And again, this was the case for H2 receptor antagonist with composite Z-score, p-value of 0.62. The limitations of the study is that this is an observational study and have a risk of residual confounding variables with unmeasured variables related to PPI and dementia. PPI and H2 receptor antagonist use may be underestimated due to inability to collect information on over-the-counter use of these medications, and they had no data on the duration of PPI and H2 receptor antagonist use prior to enrollment or their doses taken. So the take-home point from this study is among adults at least 65 years of age, use of PPI and H2 receptor antagonist was not associated with incidence of dementia, cognitive impairment, or decline in cognitive test scores over time, and therefore providing reassurance that long-term use of PPIs in older adults is unlikely to have negative effect on cognition. Our next study was also from gastroenterology this month by Sapari et al. Looking at detailed characteristics of post-discharge mortality in patients with acute pancreatitis. So this study is important because in hospital survivor patients with acute pancreatitis is high. However, there is growing evidence that patients discharged after acute pancreatitis may be at risk of serious morbidity and mortality. The aim of this study was to investigate the risk causes and predictors of most severe consequences of post-acute pancreatitis period. This was a prospective cohort study looking at prospectively collected data from patients treated for acute pancreatitis. This is based in Hungary. They collected information on 2,613 patients from 25 centers in Hungary. They were followed over a period of about 9 years between 2012 and 2021. They then compare the outcomes of these acute pancreatitis patients to general and hospital-based population who were used as the control group. And the main primary outcome was the mortality after discharge. So when they looked at the 12-month mortality rate, the 12-month post-discharge mortality rate in patients who were admitted with acute pancreatitis was 5.5%. And 3% of these mortality this mortality rate was accounted for in the first 90 days. Also, when comparing to patients with acute pancreatitis who died during their hospitalization, the 12-month post-discharge mortality rate of 5.5 actually was higher than the mortality rate of these patients in the hospital, which was 3.5% or so in this study. The incidence rate of mortality in the total acute pancreatitis population was 40 person-years, which was significantly higher than 13 person-years, which was used as which was found in the control group in the general population. And this gives the incidence risk ratio for mortality in acute pancreatitis patient of 3.1. When looking at 12-month survival by severity, these authors found that the 12-month survival at 12 months was significantly lower in patients, not surprisingly, who had severe acute pancreatitis, who had long length of hospital stay, who had local complications from acute pancreatitis, who had pancreatic necrosis, and who were known to have organ failure during their hospitalization. The cause of death in these acute pancreatitis patients was secondary to heart failure, acute pancreatitis-related sepsis or infection, cancer-related causes, other sepsis or infection, and other causes which they don't really, it's not really defined here, but accounted for around 13.6% in the first 12 months. The main limitation of the study is that general population was used as the control group, which is not ideal. Median follow-up was only 3 years, and not all patients had the full follow-up period of 8 years. The cause of death were collected retrospectively, and therefore it's prone to bias. Study was conducted in Hungary, and therefore may not be generalizable to other countries with different healthcare systems. So the take-home point is that almost as many patients in the acute pancreatitis cohort died in the first 90-day period after discharge as during the hospital stay. Evaluation for cardiovascular status, following up these patients closely for local complications, and for oncological care should be an essential part of post-acute pancreatitis patient care, especially during the first 90 days after discharge. Our next study is from the American Journal of Gastroenterology. This is a network meta-analysis looking at the speed of early symptomatic remission in patients with moderate to severe ulcerative colitis with various advanced therapies. So the study is important because the rapidity of symptom resolution guides treatment choice in patients with moderate to severe ulcerative colitis. And so these authors performed a systematic review and network meta-analysis comparing early symptomatic remission with approved therapies. This was a systematic review and meta-analysis of 14 randomized trials published up to the end of 2022. The treatments evaluated in this meta-analysis included TNF-alpha antagonists, such as infliximab, adalimumab, golimumab, also then followed by vedolizumab, ustekinumab, JAK inhibitors such as tofacitinib, filgotinib, upadacitinib, and ozanimod. They looked at randomized trials comparing one treatment versus another, or treatment versus placebo. And this meta-analysis focused on early symptomatic remission based on partial Mayo scores evaluated at 2, 4, and 6 weeks post-initiation of treatment. And the primary outcome was to compare the speed of early symptomatic remission with advanced therapies in patients with moderate to severe ulcerative colitis. So when they looked at the proportion of patients who were able to achieve symptomatic remission and looked at the efficacy of these various medications versus placebo, they found that the percentage of patients achieving symptomatic remission was the highest with upadacitinib at week 2, week 4, and week 6. And you can see from this bar graph here at the end. They then compared each advanced therapy versus another at achieving rapid symptomatic remission at 2 and 4 weeks. And what they are finding is that upadacitinib was more effective than all other agents in achieving symptomatic remission at weeks 2 and 6, as you can see here. And TNF-alpha antagonists and filgotinib, but not ustekinumab and vedolizumab, were more effective than ozanimod in achieving symptomatic remission at week 2, but not week 6. The limitation of this meta-analysis is that symptoms may not always correlate with endoscopic findings, such that rapid resolution of symptoms may not imply achievement of mucosal healing. Data for some medications were incomplete. For example, they were unable to synthesize data on tofacitinib in this review due to remission endpoint data based on stool frequency and rectal bleeding. And they were also unable to consistently examine differences in speed of onset of action by prior exposure to a TNF-alpha antagonist, which is a key effect modifier. So the take-home point from this study is that upadacitinib was superior to all other agents in achieving early symptomatic remission within 2 weeks. By contrast, ozanimod may take longer to achieve symptomatic remission compared with JAK inhibitors and TNF-alpha antagonists. Therefore, patients with severe limiting symptoms may benefit from JAK inhibitors or TNF-alpha antagonists, especially upadacitinib. So to recap, among adults at least 65 years of age, use of PPI or H2 receptor antagonists was not associated with incidence of dementia, cognitive impairment, or declines in cognitive test scores over time, thus providing reassurance that long-term use of PPIs in older adults is unlikely to have a negative effect on cognition. Almost as many patients in acute pancreatitis cohort in the study from the Hungarian pancreatitis study group died in the first 90-day period after discharge as during the hospital stay. Evaluation of cardiovascular status, follow-up of local complications and oncological care. Therefore, these authors recommend should be an essential part of post-acute pancreatitis patient care, especially during the first 90 days after discharge. And in this network meta-analysis comparing advanced therapies in patients with moderate to severe ulcerative colitis, upadacitinib was superior to all other agents in achieving early symptomatic remission within 2 weeks, and by contrast, ozanimod may take longer to achieve symptomatic remission compared to JAK inhibitors and TNF-alpha antagonists. All right, so our next monthly EGI Journal Club will be on October 4th, 2023. That's the first Wednesday of October. We'll keep it short and sweet this month. Thank you so much for joining us, and please have a wonderful day, week, and month, and we'll see you in October. Thank you so much.